Did ancient cultures use basic fam principles for birth control? Throughout history, humans have always looked for ways to manage reproduction, and many ancient cultures had surprisingly sophisticated ideas about fertility and contraception. While they didn't have modern science or the terminology we use today, some practices align closely with what we now call fertility awareness methods. These methods involve observing natural signs of fertility and using that knowledge to prevent pregnancy. For example, some indigenous American groups paid close attention to changes in vaginal discharge, which can indicate when a woman is fertile or infertile. By tracking these signs, they could choose when to have sex or avoid it to prevent pregnancy naturally. This is very similar to modern fertility awareness methods, which relying on monitoring cervical mucus, basal body temperature, and other fertility signs. Another ancient method was the withdrawal or coitus interruptus. This involves pulling out before ejaculation to reduce the chance of sperm entering the vagina. It is one of the oldest known methods and is mentioned in ancient texts from different parts of the world, including the Bible and early Chinese and Indian writings. While not a true fertility awareness method, it shows an early understanding of timing and behavior to influence reproduction. Ancient Egyptians also used barrier and spermicidal methods. They created vaginal pessaries from natural substances like honey, acacia leaves, and even crocodile dung. Some of these materials had spermicidal properties, aiming to kill or block sperm from reaching the egg. These practices show an understanding that physical or chemical barriers could help prevent pregnancy, often combined with awareness of fertile times. Extended breastfeeding was another natural method used in ancient Egypt and among indigenous peoples. Breastfeeding suppresses ovulation, which is a key aspect of fertility awareness. Women relied on this natural process to space pregnancies, a practice still recognized today as part of natural family planning. Additionally, many cultures used herbal remedies with contraceptive properties. Indigenous Americans and enslaved Africans in early America knew about certain herbs that could influence fertility. These herbal methods were often combined with behavioral knowledge of fertility signs, creating a layered approach to birth control. In summary, even without the scientific framework we have today, ancient cultures demonstrated a clear understanding of fertility signs and timing. They used observation of bodily signs, natural methods like breastfeeding, and barrier or herbal techniques to influence reproduction. These practices laid the groundwork for modern fertility awareness methods, which are more precise today but still based on understanding the body's natural fertility signals. From a sex health and STD perspective, it's important to remember that these ancient methods did not protect against sexually transmitted infections. Modern methods like fertility awareness requiring careful education and are not a substitute for protection against STDs. Always consult healthcare professionals for personalized advice and comprehensive sexual health strategies.